studies in biological sciences at FIU in Miami. And I started at the Family Medicine of Boca about a month and a half ago now, and that's where John and I had met. And he shares the same belief as I do as far as really pushing preventative care as the forefront of medicine rather than starting over with drugs and going on from there, because majority of the things that we treat in a family care setting can be reversible. And we'll go a little bit about about blood sugar and about diabetes and so forth as it being a little bit reversible, and certain lifestyle modifications that you can take. So I'll kind of take over. John will take over now, and we'll
yeah. I do, so that is what is amazing or awesome about this. A lot of times you go to the doctor, you get a prescription, you walk out the door, right? And you're just on a medication. Working with Shiv and this health coaching dynamic, we really put the patient in the center, and we're trying to get the patient involved because it's your health, right? It's your health at the end of the day. So in today's presentation, working with Shiv, these are the topics that we're going to talk about quickly. The epidemic of high blood sugar, how we got to this point, the science behind blood sugar, so talking about insulin and insulin resistance for a minute, the complications that blood sugar can lead to, and then we are going to talk about lifestyle changes like diet and exercise and supplements and things you could do naturally, like Shiv said, to help you with managing your blood sugar. So here's an interesting map, right, Shiv? We were looking at this earlier today. If you could see this, in 2004 is on your left, and then 2008 is in the middle, and 2016 is on the right. The dark spots that you see there are areas of the population whose diabetes levels are between 12 and 33%, or a third of the population. So as you can see, 2004 is not that long ago, right? I mean, Shiv, we're not talking about this study in 1950.
No, it's fairly recent. And look at the huge increase in the population, just going by that. I mean, in 4 years, and then in 8 years, you see how many dots that is. I mean, that's what we call epidemic for sure.
Yeah. So I mean, slowly but surely that whole entire, our country is going to be in the dark, and basically that means a third of the population has diabetes. Now, I want to say again, Shiv, you see 15 to 20 patients a day. About how many of them would you say are either diabetic or pre-diabetic?
80 to 90%. 80 to 90% of my patients are in that range. They're flirting with the range. They are diabetic. They're trying to manage it the best that they can. And I can tell you that only in 3 years since I've been practicing, I feel like the number has gone up tremendous. Of the patients that I have seen. I mean, I'm dealing with diabetes, and every other family care physician, PA, nurse practitioner, every healthcare professional on a family care setting has to know diabetes in and out, because that's the norm.
Yeah.
That's the norm in our patients now.
It's fair to say, let's say from 1900 to 2004, right? If that map, if we go back, that means that before 2004, I mean, the levels slowly grew. Now they're skyrocketing.
Yeah.
I mean, and the medication is obviously not the cure, right? I mean, we're going to get into that a little bit later. But let's talk for a second about obesity, right? Because you're seeing that many patients with the diabetes. And now this map shows obesity rates. This is 2019. So look at this, guys. Pink almost turning red. This is 50% of the population in these states. 50% are classified obese. So look at the United States. I mean, California, which is, by most standards, a health-minded state, is still in like the 20%. You see way here, upper Northeast, maybe here, and there's definitely pockets here that are less populated, right? But look at the country. It's basically 40% and up. So how did we get here, Shiv? How are we at this point?
I would say a lot of things. I mean, America on a whole, if you compare it to the rest of the world, is not number one in health consciousness. It's just not. If you go outside and you walk 2 miles, you'll probably find 6 fast food places, different kinds.
Yeah.
McDonald's, Taco Bell, Burger King, every one of that. And the fast food industry has taken a toll on a lot of things. That's one way. Another way is starting from young. I mean, You know, the diet for a young child is full of sugar, full of fats, full of everything.
Yeah.
And you know, John and I had a discussion about Coke. I mean, it's what is it, 80 grams or 70 grams?
Some cans of soda are actually 80 grams of soda. Like it should have a warning label. I think actually some countries are talking about that. That it
Yeah,
should, right? I mean, Andy, you laugh, but that's more sugar than you should have in an entire day. You should be around 50 grams of sugar tops. You drink a
tops.
can of soda, and you know it's and we're going to talk about how sugar is actually pretty much a drug. We're going to talk about that in a little bit. But you just blew your entire blood sugar
Entire
management
diet
in one
out.
can of soda.
Yeah, it's just completely done. And I feel like now the social norm, and when it comes to high blood sugar or diabetes, is like, okay, well, you know, I have I have blood sugar, I have diabetes, and it's a normal thing. I mean, it really is. It's just people
No,
talking about, yeah,
it really is. If 1 out of 2 people in some of these states have it, it obviously is absolutely normal. We were kidding around in a way, saying like, "What took you so long to get to be diabetic?" It's sad. I mean, it's sad that we've gotten to this point so quickly. And obviously, this kind of goes without saying. If half the country is obese, how many of the diabetic patients are obese? Would you say, Shiv?
a good amount. I would probably say 75% to 80% are obese.
Yeah, so it's a huge correlation. One of the kind of like uh, the dead ends with obesity is going to be high blood sugar. It's just one of the many. And this slide, just to show the staggering cost of diabetes, we're talking 30 million Americans have diabetes. 86 million are diagnosed pre-diabetic. This doesn't take into account all the ones that aren't diagnosed yet, right?
Mm-hmm. Mm-hmm.
So I mean it's a third, and this is interesting here. People with diagnosed diabetes have healthcare costs 2.3 times higher than if they didn't have the disease. So even on a personal level, we know that there's a lot of costs in the industry, in the medical industry related to diabetes. But even on a personal level, it hits the person in the pocketbook as well, right? They're spending a lot more money just on visits and drugs and everything else.
Exactly. Mm-hmm.
So that's the good news. it, we talked a little bit about how we got here. Now, I do want to talk about this because, seriously, sugar is a drug, right? I mean, it's actually classified with the same kind of reactions of alcohol and tobacco. It's that powerful. So eating sugar gives your brain a huge surge of a feel-good chemical called dopamine, which explains why you're more likely to crave a candy bar at 3 than an apple or a carrot. Yeah, wouldn't we all love to crave an apple or a carrot, as opposed to the candy bar? But the reason is, we are literally addicted to sugar, right? We're hooked on sugar. The food companies know this. In America more than anywhere else, it's all about selling, and so we're hooked on it. What can you add to that, Shiv, as far as your understanding with the reaction for
Well,
sugar and how powerful it is?
yeah, I mean, it is. I myself have the craving, and I could tell you multiple people that I know that are close to me that are in the healthcare field all have the craving. We all eat something for lunch, and then we crave a little bit something sweet to have, either it's chocolate or ice cream or something, and
Yeah,
that just links to the fact that it
yeah.
that it releases dopamine, and it's a feel good drug. It makes you feel nice. It makes you feel happy, and that's what classifies as you getting addicted to it.
Yeah, so I want to say this to the people on the call and the people maybe watching the replay that, it's not your fault. Like the sugar is an addictive substance. It's not your fault. I was there very much so, and I've gotten, much better, but it takes time. It takes some real just learning maybe things that you can substitute for what you wanted, for something that's a little bit healthier. But, we were talking about it, Shift, too. Like in this society, it's really not a big deal, right? To go and get, the Big Mac. It's just normal. It's not a big deal. And so we're just trained where those type of foods and the reactions are not any consequence that we're going to face. So we're going to talk a little bit about the actual real, sugar, the science, right? So what happens when I eat that Big Mac? What happens when I have a ton of carbs or something that has, well, you could explain, it's high glycemic and what happens to the reaction in the body, Shiv.
Sure, absolutely. So when we eat a high intake of carbohydrates, we get a high insulin response. Now, what does that mean? So I'll start small. Insulin is basically the lock and key. It's basically the key to open up the cell to allow glucose in. That's what the insulin is. So that's what we need insulin for in our body. What happens is that when we eat a high carbohydrate meal, insulin drives up because glucose is up. And carbohydrates, 100% of carbohydrates turn into glucose. So there's a cool chart here. I think John has at some point. We'll talk about it. But that's basically how insulin works. It's allowing the glucose to enter the cell. So this is the chart here, and the insulin is green and glucose is the blue. So what tends to happen in a high carb meal is that you get the huge spike of the glucose and you get the huge spike of the insulin. And then when the insulin is high, glucose gets shoved into the cell. And then your glucose drops. As you can see here, the blue line drops. But then since you had such a high carbohydrate diet insulin is basically still there because it was such a high intake of carbs. So what happens here in this insulin response, why it's so high, you get hungry and you want another meal. So then that's where the other spike comes in. So it's a cycle, and this leads to overeating and then thereby obesity and et cetera, and et cetera. So this chart here is actually pretty good. This is what happens when you have a high carbohydrate, a high carb diet.
Yeah,
Also,
we call it the blood sugar roller coaster, right?
Exactly.
Yeah.
Blood sugar roller coaster.
You know, and if you see how quickly the glucose goes up and down, I mean, you had the meal at 8, you shot up by 9, and it's back down by 9:30. I mean, it's literally like a drug. I mean, I call it like the lighter fluid on a fire. You know, as soon as it hits the fire, it evaporates, the lighter fluid, and that's kind of the glucose. But the insulin stayed high, and it never went back down before you had your next rush of glucose. And what I want to point out as a health coach is, you see this dark gray area here? This is what we call the fat burning zone. So your body will not burn fat as long as you have insulin levels that are elevated. So if you're trying to lose weight and you have a lot of insulin in your blood, you're also creating cortisone and we'll talk a little bit about that as well. But you're never going to lose weight because you're telling your body it's not time to burn fat.
Exactly.
So it's a direct correlate. Now this slide kind of shows you that you did have, you know, your high glucose spike, the insulin came in, did its job, the glucose went back down. But if you wait long enough, if you're not eating it, you know, in a 2 or 3 hour window, your insulin is back down to the normal level, and now you're back in the fat burning zone. So what I teach people is to eat obviously less what we call glycemic foods that turn instantly into sugar. So that's the processed foods, that's the pastas, that's the bread. I took Shiv off bagels and he hates me for it. You know, bread is one of those things that everybody loves. And when bread is eaten in certain combinations and certain moderation, and definitely wheat bread and things like that, it doesn't tend to be quite, you know, as detrimental. But there's no doubt that the processed white bread is nothing but sugar. That's all it is. It's nothing but sugar, guys. If you're going to have it once or twice a week, according to my 80-20 method, that's cool. But if you're having it every day, listen, I used to have toast for breakfast, a sandwich for lunch, and some Cuban bread for dinner, right? Bread was part of every meal. And my cholesterol was 300 in my 20s. And there's no doubt, yeah. And, you know, so, you know, it was bread at every meal. Bread was the hardest thing for me to give up, all right? Scout's honor, I'll admit it. For me, bread was the hardest thing to give up. And now, you know, I barely have bread, you know, and your body comes around like anything else. Your body can learn new things, and it can actually crave different things, and we'll get back to that in a minute. But you guys are good with this. I think this is a real, like, kind of like a way that you probably haven't looked at this before. Before we move on, Shiv, why don't you tell us a little bit about, you know, some of the things obviously that the high blood sugar can lead to, and also high insulin can lead to. And I know there's a million, but maybe take the top ones.
I'll do a couple. Yeah. So high blood glucose, if you do not manage it properly, obviously will lead to the condition everyone's normal to now is diabetes. And then once you have diabetes, it affects almost everything else in your body, to your eyes, to your lower extremities, your hand. You can feel numbness. You can feel no pain at all. You can feel tingling. It affects your kidneys, where it deteriorates your kidneys. But mostly all, it's a vascular disease. But what does that mean? It affects all the vessels in your body, your veins, your arteries, and so forth. That can lead to obviously a heart attack, and it affects the blood vessels in your eyes, which can lead to loss of sight. So really, if you do not manage your blood glucose properly or effectively, the detrimental effects to it down the road it's numerous, and it affects every single thing. Our quality of life will diminish at some point if we do not take care of it.
And medically speaking, how do you treat the diabetes or even if it's pre-diabetic, what kind of medication normally, like what's the protocol that you start with?
Yeah, protocol for pre-diabetic is that you have a number of hemoglobin A1C that we test. And that ranges from 5.7 to about 6.5 is pre-diabetic range. Anything above that, you're hit diabetes. Now, the first thing is if the number becomes high, 5.7, 5.8, 5.9, and etc., we start with lifestyle modifications. And what does that mean? You diet and you exercise as much as you can. You switch up everything that's going on in your life. You decrease your stress level. You have better sleep patterns. That's the first line. And every family care provider should be pushing that first. If that doesn't work, then you go on to medications. And it may be one medication to start off with. That doesn't work, you add another one. If that doesn't work, you may add another one, or you go straight to insulin, which is an injection every day in your stomach or so. So that's the last resort, basically.
So I think I could say what we all know, there is no cure, medically speaking, for blood sugar and diabetes.
No, there's not. There's only managing it for medication.
Yeah.
Now it can be reversible, right? And the only way to reverse it or to manage it better or more effectively is lifestyle modifications and diet.
Yeah, I mean, if you have a healthy person, right, all things being equal, right, you have a healthy liver, you have a healthy kidney, if you have healthy organs, what is amazing about blood sugar is it's directly related to sugar coming in and the blood sugar level going up, right? I mean, it's really that direct. It's so direct, right? So what we put, where cholesterol and blood pressure and things like that are a little bit like vague or not, there's different elements, but blood sugar is sugar in, blood sugar up, right?
Yeah, as long as you are exercising a good amount and you're eating properly, it can all just be managed by doing that.
Yeah.
Managed doing that.
Yeah. So I think that's great news. And, here I am, like, I don't know how many people I see with the same problem. And we kind of, I don't know, we're not addressing it, right? I think, unfortunately, the medication, Shiv, gives people this open door to just keep their behaviors,
Yeah.
right? Because I'm managing with the medication, so I'm going to continue the lifestyle.
Yeah. And I mean, I talk to my patient about this every day, is that the medication we give you is not something that's going to save you from all the other detrimental effects that I told you guys about before. You have to change your lifestyle. You have to change what you eat, and you have to exercise, or these things will end up becoming worse.
Yeah, I mean, it's a deteriorating, debilitating, disease, and we take it, I think, for granted because it's so common and so pervasive, right? Here's on the right, this is the taboo stuff, Andy. Candy, soda, pastries, sugary cereals, basically everything we love, right, in America. You know what? The American diet is the SAD diet, the standard American diet. It stands for SAD. This is the standard American diet: white rice, white flour, pasta. Everybody loves pasta, and then white breads. I mean, come on, can't we have one of these?
Well, yeah, I mean, everything is good in moderation, right, John? So you have the 80-20 rule.
Yeah.
where you have some leeway to eat a little bit, or quote unquote cheat on your diet if you may, but these things have to come at a price. It has to come from you doing everything right for 3 to 4 days, 5 days straight, and then maybe a half of a donut or a quarter of a donut can be your treat.
Yeah. Yeah. I mean, I think my lifestyle was 80-20 the opposite way. Like this on the
Yeah.
right was, yeah, I was 80% of my diet. I had a donut every day or two. My coffee used to be cream and sugar and like no coffee. Like it was all just, basically cream and sugar.
It's
It
all
was like, I don't
sweet.
know, 4 or 5 sugar. I used to add a ton of sugar to my coffee. Now I have it black, no sugar, love it.
Yeah.
Cereals every day, right? We teach our kids. I'm guilty of it too. It's fast, it's easy. We give our kids cereal.
Yeah. Yeah.
Killing them. White
As I say,
bread.
it starts small. It
Yeah.
starts at a young age, and this is why we're in the position that we're in right now.
And now what's not in here is wine and alcohol. Do you have something to add, to say about wine and alcohol, or just alcohol in particular as far as this?
Yeah. So alcohol, no matter what alcohol you have, it has a high, especially beer has high carbohydrates. Wine itself is very high in sugar. So drinking that alone will elevate your blood glucose. Also, in addition, though, it affects your liver on a side note, and if your liver is not able to filter out your blood properly and so forth, that has detrimental effects later on too, unrelated to diabetes, but also too it can be related to diabetes at the same time as well. I mean, everything is connected in our body.
Yeah, and
So one
so
thing,
I would say in moderation, right? But if you have this situation, if you're already diabetic, if you have high blood sugar, you really got to look at the alcohol as well. And I'm not
exactly,
giving a pass to someone who doesn't, but again, a glass of wine or a glass of beer has been proven to have certain benefits, even with cholesterol,
it
right? But
can.
it's obviously once you go past that, you're causing, the negative issues.
Yeah, yeah.
Yeah.
So once you go past a certain point, it's like your diet is gonna have to cut out a lot of things quickly.
So this is the we're giving you the hard truth here because I was there. So this is the average person. I'm sure almost all my clients, the biggest challenge is sugar.
Mhm.
Like they're craving to sugar. I mean, 9 out of 10 tell me the sweet tooth is what's killing them. So this is interesting. I pulled this chart. 10 foods for diabetes. Everybody loves spinach, right? Everybody loves broccoli. I actually love these things, but I didn't always love them. It's
Yeah,
retraining your body. It's appreciating your body. It's putting in what is going to nourish your body, right? Because that's the other thing with carbs. You may feel full, but you got no nourishment out of it.
exactly.
It's just pure, it's just carbs. You didn't get protein. You didn't get any healthy fats.
Right.
Olive oils are great. Sweet potatoes. So these are, regular potatoes are much more glycemic than sweet potatoes, which sounds ironic because sweet sounds more sugary, but they're actually less.
Mhm.
Avocados, a superfood. I can eat an avocado every day. Um, Dates is one I gotta honestly say I don't think I've ever had. Not sure how you guys feel about it. Cinnamon, I have it every single day. I put some in my tea. Eggs, pretty much, every day. Tomatoes, blueberries. My smoothie every morning is blueberries and spinach with coconut almond milk. Every morning, pretty much. That's my go-to.
Good.
So, um, you know, how much of this is in your diet? And you could go further. There's basically what you want to do, Shiv, is have low glycemic foods, right?
Low glycemic food, but you want to have a balance as well.
Yeah.
And so you can't have a diet that's high on good fats or even saturated fat. You want to have a little bit of carbs, a little bit of proteins, and a little bit of fats. Fats is interesting. You have to watch with the fats that you eat because fats can prolong the carbohydrate increase or the glucose increase from carbs by a little bit by 10%.
Yeah.
So if you have a high carb diet and a high fat diet, your glucose ends up staying in your insulin level ends up staying a little bit longer, and your glucose spike is a little bit higher, and it
That's
ends up
interesting.
staying a little bit longer.
That's interesting. Well, we got a few minutes left. I wanted to touch on supplements. This is an area that, again, these are things that have worked for me. I don't diagnose or treat illnesses, but I think, working with the doctors at the practice is really good because we can help people with supplements and then retake their levels and see what's kind of working or not. And supplements is one of those things where it's very personal. What may work for somebody can easily not work for somebody else because of the way that we process things, and also because of the amount of levels you may already have in your body, and also absorption. So digestion is a big factor. If you have poor digestion, supplements won't help much because you're not digesting them. And that's the big thing about taking vitamins and supplements is, you know, if you have poor digestion, you're lucky to absorb 10% of that, so it never works for you. So fixing your digestion may be actually the first thing that you need to look at. But these are things that have been, you know, studied and proven and tested, and again, on different people have worked different ways. But magnesium, um, alpha lipoic acid, probiotics. I put also probiotics in my smoothies every morning. I drink a green tea pretty much every day. I add cinnamon into my teas every day. Vitamin B1, thiamine, vitamin D. These are some of the foods there. You know, fish are always, you know, great. Omega-3 fatty acids. So I'm not sure how much of this is in your diet, but let's take Shiv real quick. Like on blood panels, you know, when you see deficiencies, do you talk about maybe, you know, deficiencies in magnesium or B or vitamin B or D?
Yeah, exactly. So on a blood panel, you can look at vitamin B12, vitamin D, and even magnesium as well. If these numbers had, you know, are tend to be low, we always try to supplement it with them because it has greater effects than we as scientists can probably even fathom. Vitamin D, for instance, can help you know, rid of cancer cells from forming. It also helps with bone and so forth. Magnesium helps with a little bit of energy. It's an antioxidant properties as well.
Yep.
And vitamin B12 helps with energy and brain functioning. So other than just from the diabetes alone, we do have to run certain vitamins because it has other greater effects as well.
Yeah, that's key. Let's stress that again. I don't want you to run out and do all these things. The first thing you do is you go to the doctor and you get your blood work done and get real numbers so that you know where you stand. Now, I do want to mention bergamot. This thing only grows in Italy. It's like a citrus. It's like an ugly orange, which is green. And you know, we were talking about earlier today, Shiv, how people in Italy have these, you know, really long lifespans, and we know that there's a lot of different reasons. But this only grows in Italy. What a coincidence!
Yeah.
I'll send you guys this chart as well when you see the replay. But this test here, you know, showed on a 500 milligram supplement and a 1,000 milligram supplement, a 24-point decrease in cholesterol and a 28% decrease in cholesterol, and HDL going up. Look at these numbers, Shiv.
That's good numbers.
And then when you look over here, blood sugar levels also improve with a 24% decrease in the 1,000 milligram bergamot group. So, and 22% decrease in the 500, and they also had a placebo group, you know, just to make sure. And that placebo group did not improve. In fact, they got worse. So what's crazy about this supplement is you never hear about it. I mean, I've talked to this about people and no one knows about this. So, you know, I have started, you know, recommending it and testing it and trying it because these numbers are worth, you know, this is something that definitely raises an eyebrow and I think worth taking a look at. Would you agree, Shiv?
No, I do. I mean, I as a medical provider, we in school did not learn about natural supplements or natural ways or so because, you know, it's just the medical knowledge, the medical teaching is a little bit different. It rather pushes drugs more so.
Yeah, and that's why I appreciate what we do together because there's a balance, and we're helping people severely with medication to start getting it under control, but then changing their lifestyle. And by the way, guys, exercise is a huge part of it, right? So we only have a few more minutes, but you know, the exercise controls blood sugar, controls weight, controls emotion, and it lowers heart disease, blood pressure, and stress. So everything we've been talking about here is we're just going to increase the benefits of the good diet by adding exercise to it. So, and by exercise, we mean at least 20 minutes a day and at least 3 days a week where you do some vigorous exercise. We need to get that heart pumping. We need to get that blood flow going. So,
one of the reasons, if you don't mind, John, real quick, is that the main reason why exercise is so potent and such a good thing to have if you have high blood sugar is that your muscles end up needing glucose. and it's another avenue if you have excess blood glucose in your system for the glucose to go into your muscle cells. So that's why it's just opening up another avenue for that to go, and also it helps with cardiovascular health, and which is also a big deal.
Yeah, I mean, so my cholesterol numbers went from 300 to 200 diet, and I would say exercise. I tell everybody I exercise because I love to eat.
Yeah.
Not because I want to get healthy or stay healthy. I exercise because it gives me that extra 400 calories, 600 calories. And I know, like you said, it makes room for blood sugar. It makes room, obviously, like in the last slide, that all of the benefits of it. So if we have any questions, you guys can unmute yourselves. We only have a few minutes left, though. So I want to thank Shiv, our guest tonight, on this blood sugar webinar. Super enlightening and informative. And for anyone on this call, just email me, john@uplevelliving.com. Ask me for the low sugar diet. I'll email that to you. It's actually part of an app that we have called Coach Connect, so I can add you to it. Totally free. I just want I want to help you guys out as much as possible. We talked about diet. We talked about exercise. We talked about supplements. It is an entire lifestyle. You did not get to this blood sugar level overnight. And you're not going to get rid of it overnight. It's going to take some time. It's going to take 3 months of lifestyle change for your body to reset. But I promise you, your body will. Your body is an amazing thing, and it will reset. We can reverse this disease. This is a reversible disease, guys. So that's what I have to close with. Shiv, do you have any parting words?
No, I just want to say thanks for the opportunity, John, to kind of talk a little bit and help some more people in a different way. If you are ever in Boca and in Florida, if you want to stop by, it's Family Medicine of Boca. Stop by, come and say hi to us, and if you need a primary care, we'll be happy to take care of you there as well.
Thank you, Shiv, and we will be doing more of these with Shiv, so I'm looking forward to that. You guys could just tune into Up Level Living, the Facebook page, and we'll make updates there. If you're on our email list, of course, you'll get the updates there as well. So have a great night. Have an awesome Transformation Tuesday. Thanks for hanging in, and we'll see you guys next week. Take care. Bye-bye.